a little in the background if they need to, that's fine. We will discuss what it takes to care for a 21st century pet with our panel of experts to answer questions from our audience. Joining me now are veterinarian and certified cat behavior consultant, Dr. Denise Johnson. Thanks for coming all the way from Columbus, Dr. Johnson.
Thank you so much for having me.
We also have MedVet Cincinnati veterinary dentist, Dr. Emily Ward. Great to have you here, Dr. Ward.
Glad to be back.
And we have owner of Pause, Look, Listen, and certified dog trainer, Nick Hoff. Thanks for being here, Nick.
Always a pleasure.
And last but not least, Cincinnati Animal Care Shelter Director, Megan Colville. Thanks for being here, Megan, and for your team bringing these sweet dogs.
Yeah, we're happy to be here.
Well, it's great to have you all, and we want to hear from our studio audience. What questions do you have for our experts? Feel free to raise your hand, and one of our friends will come at you with a microphone when your question pops into your head. A note, though, any advice you hear is meant to be general in nature and should not substitute for a visit with your vet. I want to start with you, Denise. I recently read about drug trials they're doing on cats for weight loss drugs that are similar to Ozempic. That sounds expensive to me, but it made me wonder, how big a problem is obesity and weight, extra weight for our pets?
Oh, tremendously problematic. There are so many of my patients who struggle with weight and then the consequences of that. Orthopedically, cats are very fine-boned creatures, so carrying an extra pound means so much more strain on their joints. And when using the toilet involves climbing into a box, that can result in a lot of behavior issues. Certainly discomfort generally can result in behavior issues. If they do develop diabetes, then that increases their litter box use, and sometimes trying to trek over that hill to get into the box to use the litter is just too hard. So then we see soiling issues, and it really can snowball. So I'm tremendously excited about the potential. Again, it's still potential. It's pretty early days in terms of the research, but it's something that I'm hoping can help a lot of pets.
Yeah. Dr. Ward, is that a big issue with dogs too? I mean, how many dogs do you see come through MedVet Cincinnati that have a weight problem?
Many, unfortunately. I think one of the ways that us as humans, we like to show our affection for our companions because it feels good for us and they enjoy it too, as well as we tend to use a lot of treats and snackies. I know I'm guilty of this myself. My dogs enjoy the leftovers from the children's plates at the end of the day. Chicken fries are probably not the most healthy option for them, but they're sneaky. So it's a big issue in dogs. It's a big issue in cats. I think, fortunately for dogs, while they do get the orthopedic issues that cats get, right? Like obviously having any extra weight on you is definitely bad for your joints, and there are other metabolic issues that can come with obesity in animals, just like it can in people, cats in particular. And I think this is why they're coming up with an Ozempic-like drug for cats to help with weight loss, is because they are more prone to like what we would consider as a type 2 diabetes for humans, right? Which is probably an insulin resistance problem and is often associated with obesity, versus dogs where they typically get like a type 1 diabetes, which is more of an immune mediated condition. So at least with dogs, we don't see that sort of diabetic dysregulation, you would agree, with them?
Absolutely.
So I think like for cats, it's a much bigger issue because like the downstream effects of that added weight on them have such an impact on their ability to function normally, regulate their blood glucose. And then if your cat does get diabetes and can't modify that with diet change and other things like that, then you're talking about doing insulin for your cat and those kinds of stuff. So these kind of drugs that are coming out, I think, are a real boon to healthcare for us, even if they are very expensive, because it can help for some of these animals to not have to suffer some of those diseases that come down the line that have effects on their quality of life and their lifespan.
Yeah. Nick, how does that come into play with training? Because a lot of training involves rewards, and
Absolutely.
A lot of those rewards are food type rewards. So how does that play in? How does obesity play into those issues?
Yeah, absolutely. A common concern that my clients might raise when we are discussing training is the impact of using too many treats with their dogs. Certainly, we don't want to sacrifice one issue for another, so we don't want to replace our dog's ill behavior with an obesity issue or any other health concerns. This is why, for me personally, I always encourage my clients to use healthy treats and small treats. Predominantly, the treats that I use are actually very fancy dog foods that are going to work very well, be very interesting for the dog, but it's not going to have as much of an unhealthy impact on their weight overall. And we always want to make sure that we're moderating other factors. So if we are doing a lot more training or being a lot more generous with our treats for a period of time, then we might look at modifying how much food we're giving during those meals. And especially if we're giving balanced diet as treats, then we can get away with helping to make some adjustments there.
Well, I can say I witnessed you giving some treats to Lala before the show started, and your little magic
is
pouch
correct.
you had on your hip, and Lala really liked them, so I can vouch for that. Megan, do you see a lot of overweight pets come into the shelter? Is that something you all are dealing with when people have to surrender pets?
We certainly see more overweight pets when it is a surrender than when they come in as a stray. It's not a huge issue that we see. I'd actually argue we probably see more dogs and cats that come in probably more on the thin side. But we have had, I can think of a few more very recently that have come in that were definitely overweight that our medical team was put right to task trying to work on that. And we coordinate across our departments to make sure that animals getting the care they need to not only get to a healthy weight, but also maintain it, which can be difficult in a shelter environment.
Okay. And we have a question in the audience. Selena, hi. Can you tell us who you are and what your question is?
Hi, my name is Apurva, and my question is, I've been reading recently that there's a lot of new developments in increasing the age of your pet and keeping them healthy longer, be it drugs or like tablets or stuff like that. Do you guys know anything about that and how quickly that's going to come to the market? Because I would practically give 10 years of my life for my dog to be
I love that
around longer.
question. Yeah, I love that question. I have an old lady cat and an old man cat, and I want them to keep cooking along as long as they're happy and healthy. Does anybody have thoughts on that?
I mean, I'll speak to it to some degree. I don't know about any particular medications, although I think I know what you're referring to. There was like this wonder drug I remember reading about in the newspaper some years back where it's like it really extended the lifespan of animals, and then could it obviously then be ported over to human beings, right? Like how long can we extend lifespan? Does it reduce essentially the cellular degeneration that we see with the aging changes that we all get, right? That is the cause of us getting older and our bodies not working as well as they should and those kinds of things. I think right now, I don't know of anything particular that's coming like to the market where like a general practice veterinarian is going to sell it to you and say, great, if you give your dog this pill, they're going to live 10 more years of a life and there's nothing else you need to do. I think right now we're already, just since I've been a veterinarian for 15 years, and I think like just in the last 15 years, we're already seeing anecdotally, an extended lifespan in a lot of my patients. I didn't used to see a lot of dogs and cats over the age of 13 or 14, and now I treat many patients who are nearing 20 years old, right? And a lot of that is a better understanding by the veterinary community of how preventive care plays a huge role in the long-term health of our animals. As a dentist, I say this a lot to my clients, is that like, I am not... I'm not saving anybody's life. Their teeth, there's usually nothing I deal with is life-threatening necessarily, although, we get cancers and those kinds of things in the mouth. But as we know from human medicine, if you have good oral care and you have a healthy mouth, you tend to have good systemic health. They tend to go hand in hand. And if you have other comorbidities, say you have diabetes or kidney disease or liver disease or cancer, the reduction of inflammation in your mouth through good oral care helps to actually stabilize some of those diseases and may slow the progression of chronic conditions. So although I'm a specialist and I do, complicated surgeries and I see like probably less preventive care dentistry, I do know that in my patients who tend to be more aged, they are the ones who have had regular oral health care, and doing those everyday preventive things, making sure that they're getting their annual checks and that kind of stuff can make a huge difference in the lifespan of them. I think, Denise, you could probably speak to that since you're in general practice and do a lot of preventive care.
I think you're being very humble because sometimes quality of life and dental care are intimately entwined.
Agreed. I do improve
So
everyone's quality of life.
And unfortunately, there's a lot of quality of life decisions that sometimes factor in pain. Well, not unfortunately, but I think when you're looking at trying to get longevity, you really have to think whole animal health. Mm-hmm. So dentistry is incredibly important. our screening tools, so doing blood work on a regular basis so that you can catch things really early, making sure that you know your pet's lifestyle risk. If you have potentially more exposure to a given transmissible disease than another pet, if we do a lot of travel, exposure to woods, things like that, really having a strong relationship with your general practitioner, with your primary care veterinarian, to understand what makes my pet's risk profile, how do we generally screen for causes of concern, and just finding a good fit for moving forward in terms of what preventative care looks like for that pet. I'm a big advocate for finding what makes sense for that individual, because again, there's variable risks pet to pet, but dentistry is always a very strong, very important. You should
You've got teeth, you got to do it.
You should have bragged more about yourself and your impact on the general veterinary community. But really, I think having a primary provider that you're really confident in that collaborative care model with them, that makes a huge difference.
Yeah, sure. So unfortunately, no magic pill, but it's all the hard
Maybe-
stuff.
Maybe also fish oil.
all those check-ups.
Fish oil might be that
Wonder drug.
one magic thing.
Man, you sound like my primary care doctor right now with the fish oil. But Jen, do you have a question? Hi, tell us your name and what your question is.
Hello, my name is Ann, and I was curious. You asked the question about a medication that's being tried for dogs. And curiously enough, my dog, a golden doodle, who's 13 years old, he's part of the National Dog Aging Project. And it's a study that's been going on for about 5 or 6 years. And he gets periodic examinations of testing and labs and the sort of thing every year, just to see how his longevity is. And they do check the quality of life issues as well as diet and other things. However, one of the cohorts of the project that he's in is called the Triad. And they are studying 10,000 dogs in, I think it's the Texas area, on a drug called rapamycin. And it's a drug that's used with cancer patients, but they seem to be finding a corollary of extending the dogs' lives using this particular drug. And the dog aging project already has a study that's been published. And you can look at the study by looking at Dog Aging Project.
Wow, I'm so glad you came here today. Thank you. And we have another question. Hi.
Going back to the dental care, my name is Vivian. Going back to the dental care, should we brush our dog's teeth, and how do we get our dogs to let us brush their teeth?
Vivian, that is such a good question. I have struggled with that with my cats. Their teeth are very pointy and they don't seem to like it.
The secret is having a cat without teeth, like mine.
Do you brush your cat's gums?
No, he doesn't need that anymore. He still kills mice even without his teeth in his head.
That's
he's a pretty
impressive.
talented dude. So to answer your question, basically, yes, you should be brushing your animal's teeth. If there are teeth in the head, they need to be brushed. And that is because their mouths are nearly physiologically identical to ours. So they are full of bacteria just like ours are. Humans, we brush our teeth because we're trying to prevent cavities. That's a huge problem for us because we are riddled with strep. And we eat a lot of acidic foods and a lot of other compounding factors that make us really prone to that kind of disease. Luckily, dogs and cats, they have other problems. Cavities isn't one of them, but what we're really trying to do is to prevent gum disease in them. We're trying to prevent their body from making inflammation due to the presence of their own bacteria below the gum line. The only way to get rid of it is mechanical removal. There's no pill. There's no nothing that can do that. It's a biofilm, which is a sticky colony of bacteria that's difficult to remove. So you got to scrub, basically, with a toothbrush to remove. That's why we have to brush our teeth, too, as well. It's difficult, right? Especially cats. Their teeth are very pointy, very sharp. And so it can take a lot of training and work, and some of it's going to depend on your pet's personality. Luckily, veterinary dentists, we recognize that for 99% of our pet-owning population, this is going to be an impossible thing to do. I think the statistic right now is about 1% of pet owners are actually brushing their pet's teeth.
That sounds high. That 1%
right?
sounds high to me.
I would say based on my clientele, which are highly motivated people who care about their pets' teeth, it seems about statistically correct for me. And And the gold standard, like, you have to do it at least once every 24 hours. If you do it less often than that, you might as well just not, because that biofilm is mineralizing, and that's like, you can't get it off with a toothbrush. You got to go in with the metal scrape, you guys, like at our dentist, to get these things off, right? So if you're not doing it once every 24 hours, don't do it at home. Don't do it at home. Your pet will not like that. That'll be even worse than brushing. But basically, because we recognize that this is a really challenging thing, there's a great website out there. It's called the Veterinary Oral Health Council. On the back of your toothpaste tube, it says, the American Dental Association says this product will reduce plaque and gingivitis. That's our version of it. It's vohc.org. And you go there, and they have great information about oral health for animals, and they have a complete listing of all of the approved products for both dogs and cats. And these are things that are very easy for us to do at home, because I'll admit, I'm a bad veterinary dentist, and I do not brush my animals' teeth. Look, my cat doesn't have any, so I don't have to worry about it. But the two dogs, it's not happening. I do use a lot of VOHC products in my own house, right? So they have dental diets. They have water additives. For dogs, there are chews, because dogs love to chew on stuff. And all of these things have been shown in a slightly less biased study by the product company, and they paid for the certification to say that the product does what it's supposed to do. So dentists will always refer you to this website, and it changes all the time. Companies are really heavily investing in having dental products right now. So for cats, like I usually use, say, a water additive. If your cat has teeth, a dental diet's not a bad idea. And then overall, all that home care, the next thing you have to do is yearly preventive care with your veterinarian under anesthesia with full mouth dental radiographs. So you're getting the complete picture of oral health. Someone is cleaning the bacterial biofilm from below the gum line and then polishing everything up and treating any disease that's there, because there's very few clinical signs with dental disease in animals. So, did I answer your question? Okay.
I know we have a couple more questions. We need to take a quick break. We'll go to Selena's person next, and then Jen's person right after we come back. We'll be back after a short break. This is Cincinnati Edition. You're tuned to Cincinnati Edition on WVXU. I'm Lucy May. We're back with a live studio audience and a panel of experts to talk about pets for the full hour today. My guests are MedVet Cincinnati veterinary dentist Dr. Emily Ward, owner of Paws, Look, Listen, and certified dog trainer Nick Hoff, Cincinnati Animal Care Shelter Director Megan Colville, and veterinarian and certified cat behavior consultant Dr. Denise Johnson. Do you have questions for them? If you're here with us today, please raise your hand to ask a question. I know we have a couple. Selena, introduce us, tell us who you are and what your question is.
Hi, my name is Diane, and I have a question for Dr. Denise. It kind of goes back to the beginning. My cat Loki is a 5.5-year-old orange tabby rescue, and I love play sessions with him. We do vigorous play, and about 8 months ago, he just petered out. I even built him a treadmill, which he sleeps on now. I bring all the toys out, and he runs and hides under the bed, and I can't coax him back into our vigorous exercise play sessions.
Any ideas there?
First of all, congratulations on having an orange boy, because that really is the epitome of cat ownership right there.
Wow.
If it's something that he enjoyed previously, I would be really worried that there's some kind of discomfort that is occurring when he's doing that vigorous play. It might be orthopedic, something, in his joints. It could also be something GI-wise. Sometimes we get really focused on the idea of, oh, if we don't like to move, then it's got to be our joints. And then if we're not finding something there, then we say, oh, well, that's got to be behavior then. But I would encourage a really thorough discussion with, again, primary care. We want to have that good established relationship. Do that orthopedic exam, but also look for things like paw pad changes. I had a patient who was seemingly limping orthopedically. They had a visit with another veterinarian and they hadn't found anything on a very thorough orthopedic exam, but the darn guy had really fluffy feet. And so it took really looking under there to see that he had a condition that was actually breaking down his paw pads.
Aw.
So that was something that we have treatment for, that we had a game plan to address. And really that can make a big difference. So looking not just at the joints, but potentially derm issues, potentially a gut issue. I know if my tummy's upset, I do not want to race around the room. So looking overall, and if you can't find anything, then talking to that primary provider about, well, maybe there's some kind of a pain medication trial we could do, because cats are sneaky. They sometimes don't want to tell you where exactly it hurts, especially if your pet does have anxiety in a clinic setting. I'm not going to tell my presumed mortal enemy that my knee is ouchy, but I'm going to feel potentially more comfortable at home, and if I'm given a pain medication, and then you can see that as a function at home. The other thing that you could consider doing is getting some video of the behavior at home, and your vet may be able to see if there's limping that's subtle or any changes around litter box behavior. Again, kind of that challenge of climbing in and out can show their cards as far as if there is discomfort there. But I would really look at a medical cause first, especially because it's something that was fun before. Yeah. If we've never enjoyed that kind of specific play, then that's maybe a different concern, but we definitely want to make sure that we're comfy enjoying what we once had.
I had something to add to that might be helpful. So after ruling out any medical possible reasons or physiological pain related, it could be also something going on where there may have just been a unexpected or startling event that previously happened with the play. So if we're seeing a fear reaction to kind of bringing out the toys, if maybe like a loud noise or something startling had happened previously during a play session, our animals might make a connection with the play and the scary thing. And so we might see them kind of have a overreaction to that. And so if that is maybe part of what we are seeing, just kind of maybe modifying the play or changing what you're looking for. So instead of kind of wanting to approach that play session with the outcome of vigorously exercising your pet, maybe looking at seeing what would my pet like to do, and what if I just sit on the floor and encourage them to come over, offer some treats just to kind of help to recondition some positive association, and really be mindful of how your pet is reacting or responding to you, so that you can see if your behavior or your actions are contributing to how your dog is or your cat is responding.
Sound like great tips. And Jen, you have a question also.
Hi, my name is Cindy, and this is basically a general question for dogs and cats. When your pet gets maybe 10, 11, 12 years old, how necessary is it to still get those yearly vaccinations, even including rabies, which I know is the law, but as they get older, do they really need all these vaccinations every year, especially if the cats are indoors and if the dogs are getting older and they don't go out as much?
Good question. Do you have thoughts? We'll start with you, Dr. Ward, or do you have thoughts on that? Nope. Okay, we're going to go with Dr.
I haven't been
Johnson.
vaccinated anything in more than a decade.
You missed when she made a face and pointed.
Oh,
it.
yeah, I did miss that. Yeah.
So there is going to be a little bit of an it depends, because it does depend on your individual pet's lifestyle risk and health status. There are some pets that may have medical conditions where I'm more concerned about managing their primary medical conditions than I am about vaccines. If they're at a point of compromise where I don't trust their immune system to mount a response to those vaccines. In our population, we're working with population dynamics, so we want to have as much vaccine protection as we can, again, with that individual health status in mind. When we look at who responds best and who holds on to our immune response from those vaccines, young pets, as long as they're post-weaning and mom's antibodies are kind of out of the way, they respond really well. Certain vaccines last for a really nice long time. They give us a lot of cushion. Sometimes as we get older, our immune systems, they're not as robust and they're not holding on to that memory of the vaccine. So we may think about, oh, well, they've had so many vaccines since they were a puppy or a kitten, but their memory is not what it used to be. So we need more reminders, and there may be pets that need that frequent vaccination ongoing because that protection is waning, versus some of those individuals in that population who, again, I'm not necessarily focused on vaccine because we've got bigger fish to fry. I do encourage everybody to have rabies protection, whether they are primary, indoor, or not. I don't care if your cat is in a super fancy bubble that they can't escape. The problem with rabid animals is that rabid animals do not act normally. So a bat that has rabies might make a really dumb decision to come into your home instead of staying outside. A bat that has rabies might not be feeling so well, so they might be more easily caught by your indoor pet who does not know how to catch anything. So because there's no takebacks when it comes to rabies, that's one that I think unless you have extreme reasons not to do it, there needs to be that protection on board. But the other vaccines, that again is a conversation with your primary provider about my individual pet's vaccine history, individual risks, and whether their current list of to-dos for their body can take on that task.
I've got one thing to add from the animal shelter perspective. We know that about 75% of animals come to the shelter unvaccinated, or at least not up to date on vaccines. And if your pet is at any kind of risk of potentially getting loose, getting out, and ending up in an environment like an animal shelter, we highly recommend making sure they are vaccinated. I'm not commenting to a medical reason. Obviously, I defer that. But if they are at risk of potentially finding themselves in an animal shelter, it's a really good idea to have them vaccinated, because we see a lot of cats and dogs that come to the shelter that are unvaccinated, and they get sick in environments where there's so many animals living together.
That's a great point. We have another question. I'm going to go here first.
Hi, my name is Colina, and I have a question about how do you stop a behavior that you don't like in a dog? My dog is 2, and he goes in and out all day long, and he won't just lay by the door. He'll cry and yip and make noises, and even when we're eating sometimes. So how do we stop that?
This sounds like a question for Nick.
Absolutely. So usually what I'm first going to be encouraging clients to do is to focus on what would you like your dog to do, or what would you like your pet to do, and have you worked on teaching or encouraging that. So for example, I have a couple of clients with, or I should say one client with 2 young adolescent Labradors. And they do very much this exact same thing. They want to go in and out quite frequently. And so during my 1-hour training sessions, when I go over to work with them, I'm literally working with the dogs on having them lay down for extended periods of time just to practice doing that and having them see that it's very beneficial for them. So at first I was just kind of sitting with them and rewarding them for sitting down. Then I would reward them or encourage them to lay down. Now frequently they would get right back up and I was like, that's totally fine. I'm gonna ask you to do the exact same thing. And after about a dozen times, the other dog, Lily, was able to start laying down and remain laying down for extended periods, and now she'll lay down for 10 or 15 minutes with me while I'm doing this. So now I've started to kind of teach exactly what I'd like her to do. And so if we focus first on what we want them to do, we're helping to tell the animal the exact right answer to start. And then after we've told them what the right thing is, that's where we can then look at responding more to the behaviors that we don't want, where we can try to respond by interrupting, discouraging, or utilizing, say, something like a timeout to say, hey, every time you walk over to the door, even though you just came in, I'm actually going to walk away from you or leave the room for a moment. So it's not only not working to get me to come over and let you out, but it's causing me to walk away so that you're also kind of discouraged from doing more things. Because if you go to the door, wait, I'm not letting you out, then you're going to whine, you're going to cry, you're going to scratch at the door. And if I don't want to encourage any of those things, as soon as you begin doing the behavior I don't like, I'm going to respond early on in a way that helps to discourage that. But again, we want to highlight first, what is it that we'd like them to do? And if you don't know what the answer is, then maybe your dog doesn't either. So helping to give that a little bit of thought and focusing on teaching them the right thing to start is always a good starting point.
Don't you think Nick sounds like the most zen person in the world to be able to deal with this? Now let's go to this question.
Hi, my name is Ruben. Is there anything actually in orange cats that makes them chaotic?
That's an excellent question. I think that's for you, Dr. Johnson, the chaos orange cat theory.
Well, there needs to be more research, to be honest. Right now, the prevailing theory is that there are only a few orange cat brain cells shared collectively amongst the entire population. We don't have enough substantive evidence to really cite that, so I think maybe the folks at MedVet could put together some studies, maybe do some imaging and try and...
Yeah, if you want to provide some funding, I'm sure we can
Yeah.
some cats. It's not a problem. We can
Maybe we
get that
can
done.
work on some grant writing
Yeah, I
to,
think that's
to
a great
pursue
idea.
that.
See if we can confirm
so
the
it's-
internet's idea of the one brain cell for all orange
Yes.
cat.
Again, the male orange cats are perfect and beautiful and wonderful, and I love them. Females, spice.
I disagree with you.
Really?
Oh.
My female
Vet
orange
bite,
cat
vet bite.
was an angel.
Okay.
She was a perfect little lady.
I didn't get to meet her, and she's not here today to
She also had no
show-
teeth.
Okay, well, that's cheating.
I mean, maybe if you're pulling all their teeth, they behave for you.
How many of your cats have no teeth?
Of the 3 cats I have had as an adult, 2 of them ended up toothless.
Interesting.
I mean, given her profession, it makes sense that she would be finding the cats that need homes and someone who is capable of doing that.
All veterinarians have somewhat odd and broken-ish animals, and we make them more wholer.
Yeah.
Okay.
and
This
better.
is probably not the answer you expected, is it? Okay, we have another question. I think we've got somebody up here, Selena, if you want to head this way. But go ahead.
Hi, my name is Mabel. This is just a question in general, but what's a behavior like dogs or cats have that owners think are normal but they aren't?
Ooh, that's a great one. Megan, I know you're looking at me like, why are you talking to me about this? But do you have random weird behaviors that show up at the shelter a lot that you think, why did this person think that was okay?
I think we see a lot of strange behaviors at the shelter, mostly due to, I believe, just the shelter environment. It can be very stressful for animals, and where we start getting more nervous is when they start being kind of almost nervous tics, when animals start developing behaviors that are repetitive, maybe the spinning, and some of you may have seen that, maybe a dog at the door that wants to go out starts spinning in circles. We see that in the kennels, and at that point, where those types of behaviors that are repetitive are definitely alarming to us, and we want to try to stop those. We also get a lot of obsessive behavior, maybe becoming very excited and very obsessed with a ball, for example, or a toy when the animal, or especially dogs, when they get into the play yard. So when we're seeing unusual behaviors at the shelter, it's usually not a good thing, and often related to just that kennel stress. But I'm sure Nick has some ideas for in the home, maybe some behaviors that are that he might see.
Yeah, so kind of building on what you were just saying, we can definitely see canine compulsive disorders where dogs are developing compulsive behaviors, i.e. light chasing. This would be a big reason why many of us do not recommend utilizing laser pointers as a way to exercise our dogs. One of my clients from over 15 years ago, they played light with a laser light 3 times with their dog, and he developed a lifelong condition of chasing light. So we can definitely see that.
We've seen that at the shelter as well.
Yeah.
Light chasing.
And any kind of compulsive behaviors, those are definitely ones we want to be working with our veterinary behaviorists, our veterinarians, to get their assistance. Now, on a lighter fun note, we can also see superstitious behaviors that are quirky, fun behaviors that our dogs have picked up because they thought that it was what we were looking for or what we wanted to reward. One of my previous dogs, I had one time done a trick workshop where I taught him to back up. And subsequently, during one day, he was trying to get my attention. I was just ignoring him, and he grumbled at me while walking backwards. I lost it. That became his go-to signature way of getting attention. Every single time he wanted my attention, he would grumble and walk backwards, and it worked every time. So we can see superstitious behaviors where our dog may believe that this is connected to why this works or why they get rewarded, when in fact it isn't, but from their perspective it often may be. So we can definitely see some fun, quirky behaviors, and honestly, I love those. I love to encourage those. If we are seeing anything that gives us any cause for concern, those are things that we definitely want to be talking with the professionals about addressing.
Yeah, Dr. Johnson, you had something you wanted to add?
Yeah, I'm just about jumping out of my skin because I love this question. So something that we see as normal in our pets that is a tremendous, I said that word too many times today, oh no. It's a great big red flag, and to me, it really is hugely problematic, is that pets that are eating abnormal, non-nutritive, non-food items, we see that, oh, dogs just like chewing on things, or cats just love hair ties, but it can be a sign of underlying gastrointestinal distress. Mm-hmm. It can be a sign of internal parasites, inflammation, cancers. So if your pet is eating something that is not food, please get that worked up, because that I've had so many cases that went on for longer than they needed to, when we really needed to be doing specific diagnostics to help with that.
So that can be chewing on clothes or wires or furniture, all that stuff.
Absolutely. If it's not food and we're trying to put it in our tum-tums, go to a vet.
Yes, I have had several clients whose dogs have had to have multiple surgeries for that exact issue. And yes, it often is a gastrointestinal issue is being diagnosed at that time. But it is very concerning, it's very expensive, and so it is definitely something that needs to be addressed, which I think falls into that compulsive area. Oftentimes I have a few clients where they will compulsively eat things like socks, for example, and so those are things that we definitely need to be very mindful of and working around.
Okay, we're going to take one more question. I know we have several. We'll take one more question, then we need to take a quick break, but who in the front would like to ask a question?
Hi, my name's Amy. Along that line, my 5-month-old Chihuahua puppy is biting his nails. I've never seen a dog do this before. Should I be concerned?
It's a good question. Generally speaking, I have seen multiple dogs who, simply put, just maintain their own nails, and I'm jealous. I would love a dog who just nibbled at their nails appropriately and kept them nice and trim. So I have seen several dogs where they did that and it was very normal and it caused no issues. But if it were, again, seeming to be compulsive, excessive, causing any issues, those would definitely be things that we want to look at. Is our dog dealing with stress or anything along those lines that may be impacting that? So those would be my thoughts.
Well, oh, I'm sorry, go ahead.
I'll also say a 5-month-old Chihuahua is right in the middle of teething right now. So they're going to chew on everything. But if it persists significantly beyond, say, like 12 months, something like that, when we know all the teeth are erupted and that sort of eruption pain from the teeth coming in, which is soothed by the chewing motion, if it continues beyond then, you might have them worked up for allergies, because a lot of paw licking and chewing is often a sign of allergies in animals.
Okay. Well, we will be back after a short break with the last leg of our pet show. This is Cincinnati Edition. This is Cincinnati Edition on WVXU. I'm Lucy May. We're back to wrap up today's pet show. My guests are owner of Paws Look Listen and certified dog trainer Nick Hoff, Cincinnati Animal Care Shelter Director Megan Colville, veterinarian and certified cat behavior consultant Dr. Denise Johnson, and MedVet Cincinnati veterinary dentist Dr. Emily Ward. I know we've got some questions out there. I'm going to start with Kelly, right?
Yes, this is Kelly. So I recently I'm fostering to adopt a cat, and the cat I fell in love with is about 8 months old, and she has FIP. And I probably did the worst thing you can do is start Googling about her condition. But she's on a course of medication that she's about finished up with, and I hear there's really good chances of a long, healthy life. But I was wondering if because this seems like a rather new treatment. So I was wondering about what you think expectations are for her quality of life, or are there any things I should keep an eye out for as I continue to take care of her?
Well, thanks for taking care of her, Kelly. I'm sure she's happy with you. Dr. Johnson, do you have anything you'd like to offer up?
FIP treatment is amazing, and it is such a huge boon to the community. When I graduated from vet school, you didn't have anything that you could really functionally do. Cats were euthanized, and it was just a matter of when you were going to euthanize them rather than doing any kind of really functional treatment. So we now have several different medication protocols available to us, and a big old pile of FIP kittens that are alive and thriving, and it's amazing. But also it comes with the little asterisks of, we're kind of new at this. And so we do now have cats that are kind of on the other side of it, but it's still only been a few years that this has been an option. And for a long time, while it was an option, it was an option that you had to get black market drugs from out of the country. And there was, legality concerns about whether me as a veterinarian, if I was going to get in trouble if I helped you give this to your cat. So it's really, because it's cutting edge medicine, I don't have a lot of expectations that I can give you, but I can tell you that there's a lot of cats now that have been through the treatment, are doing flippin' fantastic. The concern with, what their lifespan is that there hasn't really been a full lifespan of cat, because typically these are kittens. There are some older cats that can develop FIP, but typically our case presentation is a cute little kitten that has made you love them and then decided to do this heinous thing. So we don't know yet whether full life expectancy is something that we can count on, but I would just assume yes, because what's it going to hurt? I would keep an eye out for recurrence of the same signs that you saw before, or you dig into their medical records, see if they weren't symptomatic with you, but they were when they were through rescue, see what that development looked like for them. And again, get a really good relationship with your primary veterinary care provider, and just make sure that you know what their normal is and communicate what that normal is for that veterinary professional. I would probably be a little bit more paranoid, just knowing myself as an individual. I would probably do wellness exams every 6 months instead of, our typical is every 12 for a pet who's in a younger age range, but I'd probably go every 6 months just to set more of a baseline, and maybe just watch those globulins like a hawk. That's a blood marker that can be a red flag, but I would enjoy the heck out of your kitten.
And,
Megan, go ahead.
Yeah, I'll add, thank you for fostering, first of all. It's truly life-saving. If you have an opportunity to foster an animal from a shelter, it just makes a world of difference. But we see pretty regular FIP as well at the shelter, and these pets don't have owners. And one of the challenges we have is that the medication is very expensive. So as an animal shelter, if one way that I think our community can help is to potentially donate either money or donate the medication, if you're, donate the money to buy the medication, can actually be something very helpful to the shelter, so that we can treat more of those more complex illnesses and viruses and all that type of thing. But they're also hard to keep that medication on the shelf as well. So we are currently about to treat a cat today. Actually, we just ordered some meds for FIP to do that. But again, it's expensive, and we definitely rely on our donors to assist with that.
We have a very patient person in the front row here.
Yeah, my name is Maria, and I actually have two questions. The first one is a behavioral issue. My daughter lives on a farm, and so we get a lot of animals that show up. Hello. So one of the animals that was dropped off is a very, very sweet male cat that had very ambiguous genitalia, so we had to have him checked to figure out if he was a boy or girl. But my daughter's of the opinion that he's been outside so long that he can't come in because he doesn't seem to understand anything about using a litter box. And so he's a very, very sweet little guy, and he doesn't chase mice or do anything, so living in the barn is sort of a waste of his time. So we've been trying to figure out a way to bring him in, and I had talked to my daughter and suggested getting a box that was metal, that didn't absorb things, and to try to use some special kinds of litter that somebody had told me about. Do you have any other suggestions? Because if you put him in the box, he'll go. If you don't put him in the box, he'll stand next to it. and I just, I think it may be a matter of he's just been outside so long, he just isn't making the connection.
Yeah, one immediate thought that I have regarding that is what is the surface next to the litter box where you're kind of offering both like the ability to use the litter box and not the litter box? So if we're talking about like a dirt area, gravel or something along those lines, the cat, especially having lived outside, may not see much of a difference from the substrate for which one would be the more one that they should be inclined to use. Whereas if you were to be utilizing, say, maybe a temporary in-between spot like a porch or a covered space where you can kind of have like concrete or other flooring in addition to the litter box, that would be a way that we could kind of provide some contextual cues that the litter box itself is what we want you to be using. And I've previously had success utilizing litter box attractant or a cat litter that is specifically with that formulated in there, which has helped as well.
Yeah, we did actually get him in the house.
Yeah.
And like I said, if you put him in the box,
Yeah.
he's good.
Yeah.
If you don't put him in the box, he's like, okay,
Yeah.
you got tile down, that's fine. You got carpet down, that's fine too.
It's- Yeah. We've got one more question that we might be able to take very quickly. I'm sorry, and then we might have to connect you two afterwards. Go ahead.
Hi, my name's Tom. My question is in regards to anxiety medicines for dogs. I have a 4-year-old Airedale Terrier that has been very anxious ever since we got her. And just wondering, is FDA approved like fluoxamine or whatever that drug is, or CBD or any of that? What your thoughts on that?
Yeah. Dr. Johnson, any thoughts? I have some cats that have been on Prozac, I'll say that.
Yeah, so we do have the benefit for dogs of having more actually labeled medications for anxiety and management. So fluoxetine is the generic name for Prozac. It's available as Reconcile, which is a cute little flavored tablet, dubious flavor. Some dogs
Okay.
like it, some dogs are
And
meh.
I apologize,
But-
I'm going to have to cut you off. I want to thank all my guests, owners, Dr. Emily Ward, Dr. Denise Johnson, Nick Hoff, and Megan Colville. Big thanks to our studio audience today. You've been listening to Cincinnati Edition on WVXU. I'm Lucy May. Thanks for listening.